UTIs, urinary tract infections. We see a lot of them. We see them out in the real world. We see them in the clinical settings, and it's something to understand. And since we're learning about infection and immunity and inflammation, this is a perfect one to learn about under infection. So let's get started. So urinary tract infection is an infection found within the urinary system. You can have a lower urinary tract infection, you can have an upper urinary tract infection, and truth is you can have both going on. And when you get to both going on, it's really, really bad. So lower would include your urethra, your bladder. Upper is your ureters and the kidneys. So if you hear somebody say they have an upper UTI, they're talking about it's upper. We're seeing it in the ureters or we're seeing it in the kidneys. Lower, we're looking at urethra and bladder. Just kind of an understanding of what you hear and what you see. So let's talk about urine itself. Urine is sterile and has antiseptic properties to prevent infection. It's the way our body's made. It does everything in its power to maintain homeostasis, and by doing that, our urine has antiseptic properties. What it does is it helps what's in there. It helps germs from sticking to the walls of the bladder of that system. So that's what our urine does. So as our urine fills into the bladder, there's properties in there that will prevent germs from connecting or hooking on into the bladder unless something's going on. And then that interrupts that. So that's something about urine that's very interesting. Also remember, urine drains down, not up. It's created in the kidneys, and it comes down through the ureters into the bladder, sits in the bladder, and then comes through the urethra and out. So we always want to understand that, because if you understand that it drains down and not up, whenever anytime urine is staying anywhere where it shouldn't be, if it backs up into the kidneys for some reason or anything like that, it's going to cause major issue. It has a faint odor or no odor. So lots of times you'll smell a little ammonia, just a very light, but it's nothing that's overwhelming. Urine, usually when you smell it, really doesn't have much of an odor to it, unless it's highly concentrated or we have an infection. So if they're not getting enough fluid, we're going to get that really strong smell to it, of the properties that are in it. It's usually bright yellow or dark golden yellow. If you're properly hydrated and there's no infection or anything going on, there's no odor to urine. What happens is it'll evaporate the water part of urine. So like when someone urinates, let's say in their bed or something like that, it will concentrate as the fluid goes away. The particles and that byproduct of ammonia will start to smell, and that's what you normally smell when you do smell urine. But normally when you get it straight from the source, there's really no odor to it. So when you get a funky smell, there's an issue. It should be a clear straw yellow color. It could be golden too, a little more concentrated, just depending. But it should never be brown tea color. It should never be red blood color. It should never be dark golden brown. Those colors are abnormal. Those are colors we shouldn't see. But if we're slightly dehydrated, if an elderly person isn't drinking very much, their urine's going to be concentrated. And by saying that, it's not going to be a beautiful clear yellow color. But it should be clear, because nothing should be floating around in urine that we can visually see. And it should have a yellow tone to it, color, for normal urine. So what are the causes of UTIs? One of the most common causes is E. coli. And we know we find E. coli in our stool. So that speaks volumes. We need to think about that a little bit. The other thing that we can see is BPH, which is benign prostatic hypertrophy. This is the prostate gland. It gets very big. It gets enlarged. We see it with men, elderly men. And what happens is a normal prostate will secrete actually an antimicrobial fluid. And this fluid is what helps prevent UTIs for men. So when the prostate becomes enlarged, it gets so big that it'll start to not secrete or excrete this fluid correctly. So you're not getting what you need there. And then on top of it, it gets so big, it's going to squeeze on that urethra, causing a backflow for men. So it narrows the urethra so urine can't get through it fast enough. And so it'll start to back up a little bit. And because of that, that's why we see elderly men have to go to the bathroom over and over and over again, or they'll dribble a little bit and different things like that. That comes with BPH. And saying that, they're also a little more prevalent if they have BPH to UTIs, and that's where we see it with elderly men or with men. Hormone changes, pregnancy, menopause, birth control. Let's talk about it. Hormone changes, it changes the normal flora. So when we're pregnant, the normal flora of what's going on is being changed naturally due to hormone influx. And because of that, pregnant women are more prevalent to get UTIs. Lots of times they won't even know they have UTIs. So every time they come in for a visit, they'll take a urine and they're going to check it. They're looking to see, has glucose spilled over into the urine, has protein spilled over into the urine. Those speak volumes about several things. And then also too, do they have any signs of an infection, a UTI? And they're going to check those things every time for a pregnant female. Menopausal women, what happens is there's a lack of hormones. They don't have their hormones like they used to have. So the normal flora of the vagina changes for those menopausal females. The normal flora of the vagina plays a huge role in maintaining the flora that's needed to fight off infection. And so because of where everything is located, for females, menopausal females really struggle with UTIs. They are more prevalent to them, and we'll see that due to those hormonal changes. And then birth control, of course, is a hormonal, medication that's taken for birth control, like it says, but it also will alter the actual normal flora of the body. So you can have more UTIs that way. Antibiotics, they change the normal flora. We know that. Not only UTIs, but what else do we get when we take antibiotics? Yeast infections. So the fungal piece can be an issue with this. And that's what happens. So lots of times with antibiotics, we can have fungal UTIs. Renal stones, so if we have any kind of kidney stone, they can actually block and cause urine to back up. And when urine is stagnant, or when urine goes a place that it should not go, like it doesn't come down and out, it can create a platform or a medium for things to grow. Bacteria, other things can grow there, and we can have issues. Diabetes, it's a biggie. Diabetes, we talk about, as you notice, about everything we've been talking about has to deal with hypertension and diabetes. Well, for this situation with UTIs, it's diabetes. And what happens is we'll have compromised circulation due to diabetics. That's what happens. It reaps havoc on their vascularization, their actual circulatory system. And because of that, it just causes problems with blood flow to where it needs to go. So things don't work right. Things won't work well. They'll have a decreased immune system due to diabetics, having diabetes. Glucose could be in the urine. They could be spilling glucose into the urine. That happens a lot. If we have sugar anywhere, what does sugar do? It grows things. Bacteria love sweets or sugar. We don't need it. And so if our body's not able to process and reabsorb sugar like it should in our kidneys, it will spill over. They're very large molecules. They'll spill over into the urine, and then they're there. And when they're there, they're going to cause issues in many ways. Also, they can have urinary retention due to nerve damage. So we know neuropathy takes place and they have issues with their feet and their lower extremities. Well, guess what? They have issues with their bladders. There's actual neuropathy with the bladder. And because of that, they'll have retention. And when you have retention, you hold on to urine. And so you can have a distended bladder. Anything distended, if you hold urine for long periods of time, it creates a growth medium and you can have bacteria start to grow and get UTIs. So there's a lot of things with a diabetic patient that makes them prevalent or prone to UTIs. So that's an educational thing for them. No bubble baths, perfumes, powders, scented tampons or sanitary napkins or pads. Those things can cause UTIs. They're down there, they can get into the system and cause a lot of issues. Bubble baths are huge with children. We love to have bubbles. It's fun. Who doesn't? Have a good hot bubble bath, right? And so you want to pour Mr. Bubbly into the baths. Well, it can cause UTIs. And females are more prevalent than males based on their anatomy, and same with children. Valve defects. If there's any of the valves that are in the ureter, so we have a different system, the way it works. The kidneys will make the urine flows down, but it goes through valves, and the valves are made to go down and then shut. So no urine backs back up into the kidneys. But there's different diseases out there and issues that can cause valve defects. And if that's the case, what happens is urine will go back up and can flood the kidney and also sit stagnant and create a UTI. Overextended bladders, that deals with retention. If we have immobility, there's different things that cause that. Immobility is a huge one. If you don't move and just lay there or sit there, all you do is create urine in that bladder. And after time, you might not have the urge to go based on what's going on. And your bladder will just fill and fill and fill, and you can get overextended. And guess what? Nurses have overextended bladders. It's a thing called a nursing bladder. Who can work 12-hour shifts and go to the bathroom once, maybe, if that? And that speaks volumes. We either work dehydrated or we're working with overextended bladders. But this can cause a lot of issue because the urine has been sitting in there for hours, and it can start to grow stuff if we're not careful. A decreased immune system. Any disease process that decreases our immune system can cause someone to be more prevalent to UTIs. So as you learn throughout all of med-surg this next semester and into the next, throughout your nursing school, you will understand anything that has a decreased immune system, that causes a decrease in our immune system, can cause us to be more prevalent to UTIs. And then, of course, indwelling catheters. You hear the hospitals speak continuously. No indwelling catheters. Oh, take that indwelling catheter out. Don't leave them in. Now, there are ICU patients that definitely need indwelling catheters. They're very, very sick people that need those. That's another thing. But we're also watching those patients because we don't want them to get a UTI. So important. So cleaning those Foleys, not pushing it back towards the patient, but always cleaning away, holding on to the catheter and cleaning away from the patient so that we're not introducing stuff in through that Foley catheter. But you have to always think like this. We're putting something in a sterile world. That indwelling catheter is going into a sterile world of the bladder, through the urethra into the bladder. And because of that, we're introducing, no matter how well we do it, outside to in. But that's why it's so important that we maintain sterile technique when we're inserting Foley catheters, because we can just introduce and create them to have a huge UTI. And UTIs can be very, very harmful to many people. Depends on what's going on. But elderly are at high risk for UTIs, and they can really, really really have issues with it. So for Foley catheters, get them out if you can. But think about this too. What else do? We put on briefs or depends, right? So that's why we can't, not only we don't want skin breakdown, but we also need them sitting in a moist area that's going to create the medium for things to grow and climb right up in there and create this infection. So it's so important. And that's why PureWicks, and now we have the new system for men, and that goes around and sticks around and goes up to the section on the wall also, which is awesome. But we need to think about that, if with the PureWick, changing, alternating, taking it out at times, allowing the patient to breathe and have air get down there. Large people, sometimes air gets trapped and can't get down in there. Heat gets trapped, I should say, moisture, and air really can't get down there and circulate. And so you have to think about those things. They're going to be more prevalent to yeast infections and UTIs based on that alone. So these are reasons why people get UTIs, what causes them. So start to really ponder and think when you're in the clinical setting, which patient is, even if they don't have a UTI, is my patient prevalent to a UTI? And if they're a diabetic, yes. If they have kidney stones, if they're on antibiotics, if they're elderly and have a history of BPH, definitely. Anything, if they're immobile, paralyzed, all of that, they're going to have overextended bladders. People that are paralyzed too, I want to say this and mention this, is it's not only an immobility issue or a mobility issue that they're not moving, it's also they can't feel the urge to go. And lots of times they'll have urinary retention and they have to cap themselves to urinate. If that's the case, then they're going to have retention, which causes issue, and then also introducing that catheter in, an in and out catheter, there is definitely ways of causing infection. So we have to be very clean when they're doing that. They have to be clean at home. So how do we diagnose a UTI? Well, it deals with urine. So we're going to do a clean catch if we have a patient that can urinate and do a clean catch. So that's going to actually test a UA, which is a urinalysis. And what it's going to show us is white blood cells and bacteria in the urine. So to do a clean catch, the best way to do it is you want to wait at least 2 to 3 hours after they've urinated to get a clean catch, because the more concentrated the urine, the better the specimen for us to look at and get the numbers. If it's a fresh, they've been drinking, they just urinated, and then they try again, it cannot always be the best specimen. Now you get what you have to in the offices and stuff like that, and I can just tell you, I'm one of those people. I'll come in and I have to go to the bathroom so badly whenever I get to wherever I'm going. So I go in and go to the restroom, and then they go, oh, we need a urine specimen, and then I'm like drinking the water, right? Because I need to produce some urine. So in those situations, they just do the best they can do. But ideally, a 2 to 3 hour wait is the best because it's more concentrated. We want the patient to go in, and you need to instruct them carefully. They're going to use an antimicrobial wipe to clean with. They'll clean front to back for females, men, all the way down and around, going down the head of the penis and down, get good and clean, never pulling anything into the area that can introduce bacteria to it. Clean around with a wipe, and then they need to start to urinate into the toilet. They're going to urinate into the toilet, then they need to stop, take their container, which is a sterile container, so don't have them put their fingers inside it or anything like that. Hold the outside only, and they need to then hold it 2 to 3 inches from them so they do not contaminate the specimen. We need it to be a clean catch. It's not going to be considered sterile, but it needs to be as clean as possible so we can contaminate it with outside, touching our bodies with it, our fingers, anything like that. So they need to take the cap off, leave it upright, gather it, then put the cap on. And so they'll start to urinate and finish and fill the container at least halfway full, hopefully. So that's a clean catch. They'll come in, clean from front to back or around if they're men all the way down. Then they're going to start to urinate, and then they're going to stop midway through the urination and then use their cup, put it underneath. And the whole purpose of this is to flush the system. So any microorganisms that could be on the outside of the body there, they're flushed, or in the very beginning or tip of that, they're flushed out. So we're getting a true specimen out of the bladder, and that's why we do clean catches. They'll then put the cap on, then they can wipe around it or whatever to clean if the urine gets on the outside of it. We pick those up with a glove, never pick them up with a hand that's not gloved. They are considered dirty. It's a dirty thing. You don't want to touch it. It's nasty. It's got urine on it. So always put your gloves on to gather those. Foley catheter collection. If I'm collecting urine specimen from a Foley catheter, what I want to do is there's usually a port up towards the catheter. When you look, there's a little port. You'll see it. And you want to clean that really good with a chlorhexidine wipe, cleaning that, and circular in, really getting it, and you want to do it for 30 to 60 seconds, get it really good and clean. Then you want to access it with your syringe. Most of the time they are screw on, so you can take a syringe. You don't want to touch the tip of the syringe. Put it 10 cc one, screw it on, and you're going to draw urine directly out of the Foley into. You can actually pinch off down. You'll see the little clamp. You can pull that with the rubber band up and pinch off up there to gather urine to be able to draw from if you have to wait, if they don't have urine coming, full into the tube. And so you do that. Remember always to undo that, because you don't want to create something that's going to make urine back up, right? It's supposed to come down. So you never want to do that. Make sure it's not pinched off or anything like that. But you gather your specimen. Then when you're done, you'll release that if you've clamped it in any way. Make sure that the urine is flowing properly before you ever leave a Foley catheter. And then you're going to put on your needle to this and put it into a tube if that's how you're getting it, or you can leave the needle off and squirt it gently against the side of the cup so no splashing. Be very careful because you don't want to be splashed with urine. It's a body fluid. So that's how we do a Foley catheter collection. You need to always review those. And then we like a urine culture. Always. And I want to say this also about the Foley catheter. Never, ever, ever start in your notes. Ever, ever, ever take a specimen from the bag. The only time you're able to do that is if you gather the urine immediately after the initial insertion of the Foley. You put the Foley in and urine comes down immediately, and you gather it immediately into your cup. If you're waiting for a period of time, you have to put it, then you need to get it the way by drawing from that port. It needs to be immediate. If you're waiting any amount of time, you don't want to take it from the bag ever. So rule of thumb, don't take it from the bag. Just draw it is your best bet to get an accurate. Urine cultures, they're awesome. So urine cultures, it takes about 2 days to result those. We're going to see if bacteria grows. So you definitely want to get those, send them down so they can do it. And the big rule of thumb with any culture, blood cultures, urine cultures, if you're doing a culture and an antibiotic has been ordered, you always, always gather your culture first. Get your specimen first. If it's blood, get your blood. If it's urine, get your urine. Send it down to the lab and then start your antibiotic. Do not give your antibiotic before gathering or obtaining your culture. The reason why, you're going to interfere because the antibiotic is going to immediately start to do its thing and try to kill whatever's happening in the body and get rid of the infection. And so you can actually alter your urine culture or your blood cultures if you give the antibiotic beforehand. So rule of thumb, gather your specimen and then start your antibiotic for a culture, always. One other thing is there's a cystoscope that they can take and go down a tube and look into the bladder. They can actually look as they go along, and a cystoscopy is what they call it. And you'll go down and they look with a camera to see anything and everything. If there's anything in the bladder, in the urethra, and looking, and they can look at the valves and things like that. So they can definitely go in and see that. You'll see them ordered sometimes for patients. They are actually put under, they usually go to the OR for these. They have to get in the lithotomy position, they get in the stirrups, and it's a very painful thing. So they're usually sedated, consciously sedated, if not heavily sedated, with their airway being managed. So it's something to think about. So let's talk about signs and symptoms. Pain and burning. It's very, very painful. Most patients will tell you it feels like they're, urinating shards of glass. It can be that uncomfortable. Urgency. They'll have urgencies to go. I've got to go to the bathroom, got to go to the bathroom. And then they'll go and it's just a scant amount. It's not a lot, but they'll have those urgencies. So, and that's never pleasant. It's malodorous. It is a foul, funky smell urine, and that is a sign that there's probably a UTI going on. If you gather you empty a patient's Foley, or you empty, they use the bedpan and you smell something funky, it's probably something going on. So always make sure that you let the physician know that, this is what you saw and smelled, because they might want to do a UA on them. Bladder spasms are there, and that is something that's just horrible. I mean, it's a cramping and a burning, and it doesn't end, and it spasms and causes discomfort. Costovertebral angle, CVA tenderness. You find the 12th, go down the back to the 12th actual rib, and you hand over those sites. You take your hand and lay it flat like it's pointing. Let me turn my camera on if it'll let me. I can't remember. I always have to look. Let's see. I was trying to see if I could get my camera to come on so I could show you. Actually, you lay your hand and you lay it on that 12th rib across. That's where your kidneys are located. So if you put a hand, you take your fist and you just gently hit your fist against those knuckles. It's a fist. It's not like you're pounding them. You're not beating them. It's just hit your hand. And then if they have any discomfort, that is a sign that it's actually involving the kidneys. And I will try to find a picture of that for you all. I was hoping to turn the camera on, and it won't let me. So now nursing interventions, let's talk about it. Eyes and O's, we need to know, are they putting urine out? Is there something going on where they're not putting out urine? We should be concerned. Remember, the golden number is 30 milliliters an hour. Every person should be putting out approximately 30 milliliters an hour. And if you do the math on that, 30 times 24, that's 720 milliliters in a 24-hour period. They need at least that for the kidneys to function. If you get below that number, then you need to be concerned that the renals or the kidneys are shutting down. But we want to watch what's going on with our eyes and nose. Are we taking enough fluid to make urine? That's the next thing. If we're not, then we need to increase it if they can tolerate it. Control pain and discomfort. That's what we can do with medications. Educate. We need to educate the patient. We've got to educate them on females wiping front to back, not doing bubble baths, not using perfumed products or perfumes or powders. For men, especially elderly men, standing there, urinate and just wait a few minutes. Same with females. If you have that urge to go, just wait and then watch. You probably will go again. Sometimes that happens just with the aging process. If you to urinate after having sex, that is very, very important. Intercourse, You want someone to then, a female, to go and urinate, and that will help the female prevent UTIs. We see that. We also want to remove the Foley catheter if possible. You need a doctor's order to do so. You don't just jump in there and go, I'm taking it out, and take it out. You want to remove it if the doctor orders it, and if you think it's okay or if something's going on, you might even suggest it. Encourage 2.5 to 3 liters of fluid a day if they can tolerate it. If they're congestive heart failure patients or renal failure patients, they can't drink that much. They're not going to be able to. So, but if they can, they need to, because what are we going to do? We're going to do several things. We're going to flush out anything by giving enough fluid. We'll urinate enough to flush out the bacteria and other things in there, fungus, whatever. And then also it dilutes the urine. So we're not getting this concentrated medium, and it's going to help with the issues, hopefully preventing UTIs and then flushing if we have one. Also, to take their antibiotic, all of it, always. When we talk about infection, any infection, if an antibiotic is prescribed by the physician or the practitioner, it is so vitally important that the patient takes the entire antibiotic dose. If it's 7 days worth, they need to take 7 days. You don't start to feel better and stop the antibiotic because you're so afraid, I don't need to take that much antibiotic. What happens is it starts to do its job and you start to feel better, but you need to take the whole bit or you will not kill whatever's going on with the antibiotic. Bactrim is the antibiotic of choice. So always make sure that we give them their antibiotic. When they're taking Bactrim, it's so important too that we give them plenty to drink. What happens with Bactrim, if we're not careful, if they don't have enough fluid with the antibiotic, it can actually cause a crystallization within the urine and cause more problems and issues. So we don't want that. They need to drink when they take this medicine. So things to remember: no bubble baths, perfumes, powders, etc. They cause nothing but problems and heartaches for people. Remember to always, females, wipe front to back. That is so very important, because if we wipe back to front, then we're going to introduce E. coli right on up into all of it and have major issue. Void every 2 to 3 hours. If you are a nurse, you need to make sure you do this too. Urinate after intercourse. I already talked about that. Wear cotton breathable underwear. One of the things that is huge is females want to put on all these cute little nylon whatever. Well, there's no breathing in that. Males too, if we get all caught up in there and there's no air movement, what do? We're trapping moisture, all of those things that can help create a UTI. Another thing to think about when you're thinking about clothing, and I've had a few friends this has happened with, they kept getting UTIs and they couldn't figure out, and they're like, I wipe properly, I do everything I'm supposed to do. And they were like, but I keep getting these UTIs. Well, what was going on is they were wearing yoga pants and going to work out in yoga pants, and then afterwards running the rest of their day around, right? Well, all that sweat and everything, it poured down while they were working out into that area and introduced, different microorganisms into that area. And then you had a warm, moist, trapped area with those yoga pants, and they're tight fitting, right? Because yoga sucks into the body and things don't really move well. So one of the things, suggestion was to always go home right after working out or after the workout at the gym, bring an extra pair of yoga pants if you want to put them back on, but get something clean. Something breathable is much better though, always. Air it out, ladies, air it out. Pyridium decreases spasms, but the thing with pyridium, and this is a drug, we can buy it over the counter now, right? Which is awesome because used to you had to go to the doctor and get a prescription for it. But when you take it, it's going to just make you feel so much better. It helps with the burning, it helps with the spasms. And by taking this, though, it creates a bright yellow-orange urine. It stains, guys. So, note to self, teach your patients, don't wear your best panties. Don't wear those best Victoria's Secret undies because you're going to stain them up with bright yellow if you're not careful. Even one little drip of urine on your undies and you've got a bright yellow stain. They also will stain the toilets, inside the toilets. So, you have to explain this to patients. They go for the first time and see this bright orange yellow color. They're like, oh my God, I'm dying. Something's going on. So if they're taking Pyridium or any form over the counter or from the physician, this can happen. So don't wear those good panties. Just remember that. Also, too, just so you know, avoid caffeine and alcohol. These are bladder irritants. Soda itself is a bladder irritant, but definitely soda with caffeine. So we want to stay away from that. Now, who doesn't love coffee, tea, and Cokes? That's what we live off of, right? So make sure that you teach your patient or client that they need to drink a lot and preferably water. We need to flush it with good fluids. We need to not irritate the bladder. It's already irritated. Let's add caffeine and alcohol to it. A couple other things to remember is that elderly patients really are thrown for a loop with a UTI. If you've not experienced it at work, just take my word for it. You will see they can become very confused. I mean, you think they've got end-stage Alzheimer's, how confused they become. They can become very agitated and even lash out at you and things and not even realize it. I've actually even seen clients that can't move almost. It's almost like a stroke-like. They appear as that, and they ended up with a horrible UTI. And once that was treated, they come back to their normal selves. They'll come back to baseline. So, when in doubt, when you're dealing with the elderly, especially, or anybody that is prone to or prevalent to a UTI, always do a UA. Why not? Let's just make sure. Because if that's the culprit, what an easy fix. Give them an antibiotic, kill whatever's going on, get them back to where they need to be, and then educate their loved ones and them on what to do. Also, just so you know, caffeine and alcohol will cause men to dribble more that have BPH, that benign prostatic hypertrophy. They'll have problems with dribbling. And so it's just not a good thing. So one of the things that my father, he's gone now, but what he did is he stopped drinking coffee in the morning and he ended up drinking hot chocolate. Now, I know there's some caffeine in the mix of that, I think, with the chocolate, but he found it not to be an irritant and it really just resolved his issue, and he still had a hot drink and he loved it. And if you're diabetic, he wasn't, but if you are, they have sugar-free hot chocolate. So there's ways. My mother's one to drink hot water. She'll do that sometimes. So if they need a hot beverage in the morning to help with bowel movements and different things like that, there can be changes. You got to start to think outside the box so that you can help your client think outside the box. I hope this helps with UTIs. It's just about everything you really need to know. Bactrim is the antibiotic of choice. It can cause crystallization if not given enough fluids with it. Pyridium is, and there is another name for Pyridium, and let me give that to you. It is phenanzopyridine. Don't hold me to that. Ugh. Anyway, you know how it works. That orange yellow urine. Don't wear those good panties. Anyway, I hope this helps.